Hello, beautiful people. You are live on a brand new episode of Ladies Digest, where issues in the world of women are discussed. Ladies Digest is proudly brought to you by AAU TV, the voice of higher education in Africa. In today's episode, we'll be discussing family planning. And according to the United Nations Population Fund, family planning is one of the 10 biggest public health achievements in the 20th century. It is also a very, very fundamental human right. It also helps in reducing the risk of poverty and also helps in the move for the gender equality. Remember, you can join us on our social media handles at Ladies Digest on Instagram and on Facebook and YouTube at the Association of African Universities. After this time out, we'll meet our guests. Welcome back from the short break, and as I introduced earlier on, we are discussing family planning, and I have my regular guest with me, Dr. Kwejo Wuswansa, to help us digest this issue. Welcome, Doc.
Thank you.
How has your week been?
Oh, it's been good.
Oh, okay, thank God.
Mm-hmm.
Yeah. So today we are discussing family planning.
Yes.
And I've done a very, very brief, just an introduction of the word family planning according to the United Nations Food and Population Fund. But I would want to know, as I always say, for the lay person, if I come to you, how would you be able to explain family planning, the word family planning to me?
Okay, so family planning broadly refers to various interventions or methods that are aimed at, first of all, preventing pregnancies in a way that a pregnancy is by choice, not by chance.
Choice, not by chance.
And the ultimate aim would be to space out the births in a family and then reduce the number of births. So ultimately, it will aim at reduction in population or population control, which also helps in the long term for nation development. So you know you have a regulated amount of people, you have to look over a certain number of years. So yes, so there are various interventions that try to control birth or pregnancy. The same as contraception as well. Okay,
the same, So I would say that those are the basic goals and objectives.
The basic aims,
Oh, okay. So if I come to you as a lady, as a couple with my partner, what are the different methods of family planning, and what are the I know there wouldn't be maybe the best method, but what are the things you would consider in selecting a particular family planning method for me? So I want to know the different methods and the factors that will be considered when selecting a particular method for a particular couple. Okay,
so first of all, there's the natural methods, which just take advantage of the fact that a woman is not fertile all month long. She's fertile for about 3 to 4 days, maybe 5 days in a month. So those are the other ones, and they have the modern methods, which are usually some chemical based or some scientific or medical intervention. So we have the hormonal base, which are just using estrogen and progesterone in form of either pills or injections, or in the form of an implant under your skin, or we have that one, and we have the barrier methods, where basically condoms, which mechanically prevents the gametes or the sperm and egg from meeting. Then we have the long-term ones, which can give you. So these are the condoms and the medications. Hormone medications are short-term. And then we have long-term ones, which are maybe intrauterine device.
The IUDs.
IUDs, And then we have permanent ones, which means that you won't have babies naturally again. So those are the main broad categories. With regard to what would influence a choice, there is no perfect method. However, there's a method for everyone.
Definitely.
So what happens is that you first of all need some counseling from your doctor.
Yeah.
And they will start by, first of all, knowing what you know about, your knowledge about it already.
Okay.
If you have a previous use or exposure to it. Some people have used some method in the past. Even if it's natural or modern method, something in the past, that one. And then we'll get to know for what time duration are you looking at.
Okay.
Or maybe medically it's recommended that you hold conception for a certain period, particularly if, let's say, comorbid medical conditions, maybe diabetes is not well controlled, hypertension is not well controlled.
Okay.
We want to delay conception
okay.
before. So there are scenarios where it will require that you have to take an intervention to prevent a pregnancy.
Okay.
Okay.
Yeah,
so those are the factors that will be considered in the counseling session. Then again, you'll be counseled about the mechanism, how it works,
okay,
the advantages of it, okay, the duration that it will be. So if you're looking at this, somebody wants to withhold pregnancies for, let's say, 3 years.
okay,
You factor that vis-a-vis her presentation or her clinical history, and see what. Then finally, they tell you about the side effects.
okay.
What to expect if you are using it. So
okay,
generally, that's what goes into providing a method.
okay.
Then after it's been provided for you, there's a follow-up period to see how well it's going. If you have any concerns,
yeah,
anything, yeah, up to a certain period of time. Yeah.
Okay, so I guess there's some of the side effects, or there are some cases where the side effects can be managed, or with the hope that it would maybe reduce, or there are times that if the side effect is too complex or too bad, they can remove it or try another method.
Well, it depends on the method you are using, but generally we counsel you about side effects so you know that it's something that can occur.
Okay.
And sometimes if it's a mild side effect, a mild degree, and you've been counseled about it, you probably need just reassurance or nothing else.
Okay.
Because usually it's for a phase, it would ease out after some time. So yes, if you are counseled well, you will handle it better.
Okay.
You know,
okay.
yeah.
All right. So, at what point should a couple, if I don't know if it should be before marriage or after marriage, at what point should a couple seek or consult their gynecologist for this? I know definitely it should be pre-conceptual period. So, at what point should they consult their gynecologist with regards to family planning?
Okay, well, it depends on what the couple wants.
Yeah.
Some people, soon after getting married, don't have childbearing in the immediate plans.
Okay, that's
so
true.
Yes, the couple can then seek out some contraceptive method to delay childbirth for the period. But typically, the discussion for family planning starts during the antenatal care. Someone is pregnant, and then we start. Most people who are not pregnant, never been pregnant before, are not very open to the contraception part, particularly if they are married. Because they are culturally they are looking for a baby, so contraception will not sell much with them. But usually, the WHO recommended time interval between births is about 2 years. Where you fully recover from the effect of the previous pregnancy. Particularly if you have complications, your blood pressure went up, blood sugar went up. The system has to recover in a way before you go on to another pregnancy. So then contraception is actually for everyone in between pregnancies, ideally. So the counseling and the discussion for you to choose a method will start during your antenatal care. And then probably on your last trimester, discussions will start. And then childbirth will come. There may be one first visit postnatal, the discussion goes on. Depending on if you still have questions, you haven't decided. Some people decide by childbirth that, look, I want this method. So right after delivery, before you leave the hospital it's provided.
Oh, okay, I see.
So
just after birth.
Exactly. So it depends on how the discussion goes and then what you settle on. Some people too will need maybe 2 or 3 postnatal visits. You'll find they decide I want this. Some people also get counseling, never choose any. and then come back pregnant very soon. So there are different outcomes.
Okay, I see. So you mentioned some people leaving the hospital and they've done it. So it doesn't in any way distort or affect breastfeeding or?
No.
Okay.
Usually we factor all that in making the choice for you.
Okay, that's very true.
So usually that's not.
Okay. So also as a side effect, I remember the case of a lady. I think she used the implant, the IUD, for I think 5 years or so, and she had just given birth, and she went to she had it, and she started having this irregular menstruation. She can have menses like twice a month, and the bleeding was very serious, quite, and it was draining her. I don't think that would be a mild side effect. Would that be?
Well, it's a known side effect. So typically, the hormone-based methods, let's say what she had was the implants.
Yes.
So the implants, the pills, the birth control pills that we take, and then the injectable, the 3 monthly or monthly injections. Okay. They all, because of the hormone content, they all tend to give you a few side effects. Notably, is the headaches, the mood swings, weight gain, and menstrual irregularities. These will counsel you that this was going to happen. Now, it depends. Yes, sometimes the side effects are the reason why people discontinue the method over some time because they can't deal with it. But usually, it's recommended that once you fit it, we counsel you before that. So when it does start, you need to go. Remember, I said there's a follow-up period after you've chosen a method. So during that period, all we are looking out for is how well it's sitting with you in terms of you handling the method. Then you discuss with your provider, whether nurse or doctor, that this is what you're experiencing. They would observe, depending on the severity, they may want to wait out and see. Or if it bothers you that much, they may stop that method and counsel you and provide another method.
Okay, so let's dwell a bit on the natural family planning method. How is it carried out? How is it done? What are the do's and don'ts and the precautions to be taken?
Well, natural family method usually presumes, so the presumption is that you must have regular menstrual cycles. Okay. So that you can predict where your ovulation period is. That's like a prerequisite. So when that is done, usually there are several ways to it. People use, you could use a simple, this is the apps on your phone to help you. You input the first day of your flow, and they will calculate the dates for you. By 3 months, it gets the pattern right. People use also called cycle beads, where they use the beads to check the length of your cycle, to know when they are safe and all that. So what it does is you just have to know when you are safe and when you are not safe. Okay. Then you can time intercourse with when you are not safe. When you are safe, to prevent pregnancy, and you avoid intercourse when you are not safe. You could use other things like people use maybe their body temperature first in the morning, basal body temperature, to see when they are ovulating, so they can avoid or to use cervical mucus, the consistency of it, to see if it's thin and stretchy, you know you're ovulating. So that's the period where you avoid. You could also use it on the flip side to achieve conception as well. So depending on what you... So it's just using body natural signs. So it's natural because there are no external devices or medication or interventions involved.
So on a scale of 1 to 10, how should I say effective will this method be, or will it depend on individuals?
Yes, it varies. The outcomes varies because you see, with every family method, there's something called typical use and the perfect use. The perfect use of a family planning, the perfect use is always much higher. The percentage success rate. The typical use is lower. The reason is that the perfect use presumes everything, all situations perfect, nothing, you know. But if it's a user-dependent method, like say the birth control pill, you need to take it same time every day in order to achieve the efficacy you want.
Yes.
A few hours delay could lead to ovulation and then failure and then you conceive.
That's true.
Exactly. So the perfect use presumes that the person is that religious and meticulous with the time.
With it, yeah.
Which really is not practical.
Exactly.
With most human beings. So, depending on how if the method is a user-dependent method, then the typical use becomes what you look at.
Yeah,
Typically, how people take maybe 2 pills a day or miss 1 or 2. That's what reality happens. Okay. But the advantage of the other methods like the implant, the perfect use and the typical use are almost the same. Because the human factor is sort of taken off.
Yeah,
you have a device that has a hormone loaded into a silicone implant or shell inside your body for 3 years. It works 24/7.
It's working for you.
Exactly.
You don't need to
so your own interventions are not part of it.
Yeah. Okay.
So that is likely to be more effective. Than a pill that you were taking every day.
Yeah. And also, I think our bodies even change once in a while. And if, as a lady, you don't even understand your body, it may not be safe to go for the natural.
Well, the natural presumes that you are very conversant, so you can predict your ovulation.
Okay.
If you are not the regular person, maybe your sky cycle can skip 2-3 months. Then that might not be for you.
Yes, sure.
So you need to know who you are and then for your setup.
Yeah. Okay, still on the natural method. Is this method accessible, or will it be accessible to every couple or every lady, or would there be some exception, maybe because of medical conditions or something? Would there be?
Well, usually at counseling, they start with that before they bring in the modern methods. Okay, so we will be told what to do. It has an appeal with some religious people.
Yes.
Because they don't feel certain devices
it's a sin.
are not exactly. So that's a big advantage. It has more religious and social cultural acceptance than the other modern methods. That's a big advantage for the natural ones. So usually you have a discussion with them, and then you get to know a preference from the couple that we prefer that. But technically it's for everybody. But the big underlying thing is the couple must be well motivated.
That's true.
In order to have the outcome that you want. Because it's a natural thing. Willpower plays a huge role here. So if you are not willing, or you are not so much paying attention to a few things, you could have the outcome you don't want, which is a pregnancy.
That's true. And everything will be
So even though it's culturally very acceptable to a lot of people, you need a well-motivated couple to really get you the outcomes.
Follow it religiously. And that's true. Okay, so we'll go for a quick break. Hey people, this has been Ladies Digest. In case you're just joining us, you can join us on our social media handles at Ladies Digest on Instagram and Facebook and YouTube at the Association of African Universities. We'll be right back. Welcome back, people, to Ladies Digest, and I'm still with my guest, Dr. Kweju Owusu-Ansah. So, Doc, this one is before we continue, I want to know if it's a myth or a fact. If is breastfeeding, or can breastfeeding be part of the natural family planning?
Oh yes, it's one of we call that a lactation embryo method. So what happens is that if a mother delivers and is breastfeeding consistently and on demand. Emphasis on consistently and demand. Usually, certain hormones are high enough to prevent ovulation.
Hormones,
So, in about 90% of women, that can prevent ovulation for about 4 to 6 months.
Wow.
From the time of delivery. It doesn't work for everybody. You could do it as intensely as you want.
Like the baby-friendly thing.
As that by 6 weeks, 8 weeks, your period will return. Once your cycle returns, you are fertile again.
Wow.
So, but in most women, if you do it religiously, you get benefits for the 4 to 6 months. You're not likely to ovulate or have your cycles as well. So that gives some benefits. Okay. But after 4 to 6 months, its efficacy begins to wane. So you will need alternate methods in order to continue.
Okay, so it has to do with the hormones.
Yeah.
Yeah, because I know, okay, then I think we hear that the men feel that the women are breastfeeding, so they can't come close to the woman to have sex and all that. So I guess that's what I used to hear of then. Like
because of well, I think probably other factors may have been culturally. Usually, when you deliver, you leave home to your parents. So for some time, so probably that contributed to
and they felt
that exactly, but but that shouldn't be the case.
Yeah, that's true. So that means it's a fact that it's.
Oh yes, yes, it has some benefits.
Some benefits. Okay. So can family planning help in any way to reduce STIs or any related diseases?
Yes. So STIs, usually the method that works best for STIs is what we call the barrier method.
Barrier. Okay.
Okay. Under which you have the condoms, the male condom and the female condom. Okay. So these are made of some form of rubber, or and then maybe latex or polyurethane rubber, and it helps prevent. So it would prevent the gametes from meeting. That's the contraception part. Sure. And also prevents body fluid exchange or contact.
Yeah.
Okay. So yes. For STIs, the barrier methods are the one, two. The rest do not prevent STIs.
Okay. So let's talk about the side effects. I know each method would have its associated side effect, but what are the general side effects of this family planning, or you can help with for this natural method? These are the side effects for the IUD. What are the side effects for
natural? Usually may not have any side effects because it's your body.
Okay, that's true.
Invest has a high failure rate.
Yeah. Because
of, as I said earlier, if you're not well motivated or you're not paying attention to your cycle pattern, then you may miss a few things. So it may not have much side effects with the natural.
Okay.
The side effects comes with the modern methods. So top of the list, usually the hormone-based methods are the ones I mentioned earlier: the weight gain, the mood swings, menstrual irregularity, headaches. Those are the main ones. So we have the pills, we have the injectables, 3 monthly, 1 monthly. We have the implant under the skin. Those are probably I won't say problematic, but the most
with the higher
most complaints. Then we have the intrauterine device, which may also give you slightly heavy periods. Some will complain of discharges here and there, and the cramping, particularly if it's fitted the first few days. So those are and then maybe some expulsions over time. For example, the IUD, you may expel